she received her PhD from the University of Texas. She has been the director of the Michael and Susan Dell Center for Healthy Living at the University of Texas School of Public Health for the last 10 years. Her research includes studies on individual and environmental determinants of childhood obesity, using that knowledge to develop, evaluate, and disseminate obesity prevention programs for children and their families, with a focus on underserved populations.
First of all, I'd like to thank the organizers for accepting this symposium. It's kind of nice to get together and all the groups of us record and talk about our collective results. And also to Joel Gittleson, who helped us kind of herd cats getting us together. So today I'd like to talk about the Texas Cord project. And a lot of the things that we're talking about are actually very similar to what Kirsten said. So I'd like to give a shout out to the study team investigators. I was co-PI with Nancy Butte, and Paul Sasher is here, and Sarah Barlow, and Courtney Berg-Williams. We also worked with a lot of community level partners in this project, and then I'd just like to acknowledge the funding from CDC and Michael and Susan Dell Foundation for parts of it. So, just an overview. Our study aims, as Kirsten said, these are very similar. So, we had two primary study aims: to implement and evaluate a primary prevention obesity program in low-income, ethnically diverse catchment areas in Austin and Houston. Our second aim was to implement and evaluate a systems-based secondary prevention program within a community primary prevention. And then our third aim was to look at the incremental cost effectiveness. So I'm not going to talk about that today, but we do have data on that. So our study design was kind of interesting in that we combined primary and secondary prevention approaches. So the focus behind a primary prevention approach is that if you look at the outside of this circle, it's everywhere. So these are interventions that are aimed toward the general population and are good no matter what body size you are. So healthy eating, active living, and these focus on schools, child care centers, ECE centers, primary health care, and then government and public policy. So this was actually a little bit less than the other interventions in our program. Then for secondary prevention, that's aimed at children who are already overweight and obese without many comorbidities. So these are kids who are already at risk, and so they were referred through our primary health care intervention into a more intensive and aggressive program that was family-based, and that was 12 months. So we had two catchment areas in Austin and Houston, and so part of our charge was to have a Medicaid-eligible population. And so what we did was we calculated these, using population-level data to look at the catchment areas to get an appropriate catchment area. And so we developed an index based on the percent racial ethnic population in those census tracts. We also looked at